How to find a good surgeon. Here are 6 steps. If you are in search of a good surgeon, start with your primary care physician or the physician who advised you that surgery was necessary. The physician who told you that surgery was required may be able to help you locate a great surgeon, especially if he or she is the one who chose them. If you aren't sure about what sort of surgeon you want, ask your doctor what kind of specialist they recommend. For example, an appendectomy may require a surgeon of different trade, whereas a general surgeon may complete an appendectomy. 1. Inquire about a patient's surgeon from friends, neighbors, and family. Ask a friend who has had a similar surgical procedure about their surgeon. Did they want to refer a friend going through the same thing? Did their surgeon respond to their questions? Ask your friend how happy they were with the outcome of their surgery. Did they receive all the information they needed to make an educated decision? 2. Find a support group before you look for a great surgeon. You might find a support group in your area or online if you have surgery for a common condition. Please find out about their positions by reading through the comments. You will most likely get a lot of opinions. Don't ignore the dissatisfied patients on your list. If the patient has a valid complaint about their care, think about how to pick a surgeon before you proceed further. 3. How to find a surgeon using your insurance company. Ask your insurance company for a list of local surgeons that accept your policy. The list may be found online at the insurance company's website. If your family physician suggests a surgeon, request that list. It may be short if your options are limited. Request a list for a large city if you have a limited number of options. 4. Check the credentials of the surgeon. Every state has a medical board that approves physicians and participates in disciplinary proceedings when surgeons violate their practices. Look up recommended surgeons on the state medical board's website to ensure they're permitted to practice in your state. You can remove them from your list of potential surgeons if they are not. Are their policies and networks in line with your insurance plan? 5. Make plans to see the surgeon for a consultation. You should begin scheduling a consultation when you have narrowed your surgeon list to a manageable size. A surgeon's waiting time is always a factor when considering whether or not to remove him from your list. Please discuss your procedure with at least 2 surgeons if you have an immediate need for surgery. You want to ensure you get a doctor with the experience and confidence to perform your procedure flawlessly. If you are paying your surgery cost from your pocket, please consider the operation room cost, lab charges, anesthesia charges, and all other charges related to your surgery. 6. Schedule a surgical procedure or a consultation with a different surgeon. After the consultation, you should be prepared to schedule surgery. If you are unsure which surgeon is best for you, do not schedule the procedure. Even if you find that the first surgeon is the best option, obtaining a second opinion from a different surgeon can be beneficial. It is common for insurance to cover 2 or 3 consultations. If you have found your perfect surgeon, you may proceed with your procedure, confident in your decision. Final thoughts. You have reached your goal of having a surgeon who has performed the procedure many times and continues to do so regularly. In fact, you are looking for a surgeon who has completed the process so many times that they are entirely confident. The individuals who assist the surgeons are also proficient in handling patients before, during, and after surgery.